So interesting. I've been working on it for years. We've done motel conversions. We have not been able to crack the nut in Durango. But guess what? We put in a proposal tomorrow morning, and the first thing in our proposal is education, outreach, and engagement. Because what we have found is people don't know what we're talking about, and the projects turn out better when you engage. I remember the neighborhood meetings they're terrifying. I mean, we had hundreds of people come out to the neighborhood, but there were pieces of information and questions they asked that actually made the project better. So we just all got to take a little leap of faith and good facilitation. That was the other thing. We had trained facilitators help with those conversations. So I'm still not optimistic. I'm determined to figure out something in Durango because we're a hot mess. And I'm acknowledging that we made some mistakes that we're paying for now, and it's going to take education to get us back there, to get it fixed.
And I want to just add a couple things for folks who don't know that happened between the last town hall and tonight. Because there are some sign-in sheets on your tables, and I have a list now of over 80 community members from the last meeting on August 30th who want to be part of the solution. We've started to organize. We're having a meeting in January. A survey was sent out. Folks identified areas that they want to help the community. So these are community volunteers. Another thing that's happened since the last meeting is we've established a lived experience advisory board. And many of those members are here this evening, and they'll be meeting with the community volunteers at their next meeting in a few weeks from now. And so, when this moves forward, consultation with the Lived Experience Advisory Board. We actually have a structure. Many of the members, if you want to raise your hands, if you feel comfortable, we want your input on this. And for the community members who signed up and those of you who haven't signed up, please do so tonight. We will utilize your assistance in doing community education, in doing political advocacy, in doing community building and fundraising and group activities. So again, community, what is it? Community reduces isolation or something? Ends isolation. So just know that we're building structures in the community where folks can plug in.
And I'm going to add one more thing about ISOL, which is when Jen says we had hundreds of people and it was a little scary at times, our first community meeting had 792 people. I think I had maybe 100 friends on that call. And that was amazing. Because a lot of the concerns are valid. Mm-hmm. So if you're a community member and you have those concerns, the best thing to do is talk to us. Talk to people, talk to our in-house, talk to our providers, right? Have those conversations. Again, that good neighbor agreement, the reason we came up with that is because we want to be good neighbors, house and unhoused alike, right? And so the only way we can do that, the only way we can work through NIMBY, the only way we can work through any of it is to be able to have these conversations, right? Hear each other and make sure that we can try and mitigate and make a community for everyone who's in it.
Great. First of all, thank you all for what you do. Secondly, do you partner with the municipalities and the businesses within those municipalities to offer your clients employment opportunities?
Yes, we do, and we have a lot of business communities who've been remarkable partners in offering business opportunities and bringing food and partnership in almost every single location there's set up.
Any idea what percent of your clients have transitioned from lack of employment to being employed?
I can give you the latest statistics in Aurora, because I was on that meeting this morning. So they're seeing about a 75% increase in employment within 6 months. And again, it's training, finding the right fit, right? What's going to work for you might not work for me, but it is because of our businesses and our local community partners that we're able to offer so many opportunities.
I work in the homeless clinic here in town. I'm a case manager. What is your relationship with medical entities in the different places you go?
Again, part of that collaboration is medical, right? We try and bring in, so Durango, Access Health, right? In Aurora, we will run mental health. We have hospital nurses and doctors who come to site. For a lot of our community partners and outreach workers, actually being able to come to site and or have us transport to them has made streamlined care. So it's whether it's physical health, mental health, whether it's substance abuse, TV, school, education, jobs, Our goal is to try and streamline that connection so that we can help with those wraparound services. So medical is a huge, huge component. And again, really glad to be back in person.
My name is Erica Kidd. I'm a program manager over at the Santa Fe Suites in St. Elizabeth. And I just wanted to bring this conversation a little bit more back to the systems piece because I think it's critical. This is very much an entry spot. And with St. Elizabeth, we're doing quite a bit over there. We have 2 shelters, the men's shelter, the women's shelter, Casa Familia. And we also have 3 supportive housing programs. And that's Casa Cerrillos, that's serving the chronically homeless. We have Sonrisa, which is serving families. And then we have the Santa Fe Suites, which is 123 units of a lot of work. And that being said, of those 123 units, we have 6 that support Cancer Foundation, individuals going through treatment there. Let's see, 3 staff units. We have property management that takes care of that aspect so that the supportive housing social workers can do the work to not only get people out, but to maintain housing, which is a whole other discussion that probably needs to happen as well. The way that we're providing services is we have 2 social workers on site, myself, a supportive housing navigator, and every one of you providers out there that's had a conversation, picked up a bag of food, talked to any of our staff, could you raise your hand, been a discharge nurse? Help me out here, come on, make me look cool, please. Interfaith. I mean, all these hands, get them up there, come on, I worked hard for this thing, come on. All these people represent a group of people that are in and out and helping individuals, because we can't do it all. We have 71 individuals that are living at the suites that have been homeless, previously homeless. We have 46 individuals that are constantly, we are working with to get through this system of becoming sustainable. In 2 years, we've been able to get 18 individuals either into senior housing or Section 8 vouchers. Those can go, and that allows for another 18 people to come in that have experienced homelessness. We also have another 5 that either gone to a higher level care nursing home, or they have been able to pass on while being housed, which I'm pretty proud of that. So the systems have to work. We need to work with our partners. We also have a lot of outreach that happens in our vicinity. I don't know if you've heard of all of the issues around homelessness in Albertsons. I'm here to say those panhandlers are not residents at the suites. It's true. I have maybe one person that begs for money for a hamburger once in a while, but I'm working on it, Edward. And the things that we're providing at the suites, we have health care for the homeless coming once a week. And we're trying to pull that in. We're addressing medical issues. We have AA that's going on. The case management services that we are doing, we're doing the work. So, this is just one step. Park rangers chasing around individuals that can't be in their tent consistently in one spot is hurting cats. If we can't find individuals, they're never going to get housed or get into the system that takes years to get this voucher that can change their lives. We have to be able to get them an ID, which means we have to be able to find them. We have to be able to find them where they are at, not where we want them to be, where they are at right now. And those of you that own homes, I'm glad your property values are going okay. But how much are our lived experience people's lives worth? You all are one step away to having to be in that lived experience. One car accident. So take that into consideration and consider these individuals have names, stories. You're not the homeless.
walking around with a voucher. But we don't have the units that take those vouchers. Very important fact, right? How many walking vouchers we have people who could go into housing if that housing opened up.
Yeah, and I mentioned at the last town hall, we've actually turned money back to the federal government in vouchers because we have not been able to utilize them in this community due to lack of affordable housing. Okay, time check, we've got about 15 minutes left. I have a comment here, 2 here, 1 here. Okay, so 2 minutes, Ricky.
Okay, my question is regarding felons. Do you allow felons in your program?
Some absolutely do.
I'm coming your way.
This is huge, right? Because we have people who some absolutely do. Some have a 5 year, some have an early assault, but in order to be truly low barrier, we have to serve people, right? If we want individuals to get up and move towards stability, we have to offer services to people.
Yes, hello, I'm Joe Dudziak. I volunteer at Pete's Place a lot for the last decade. I've also started Chapel Hill Street Outreach, so I hike around to the camps. I hike around to where people are camping, which anymore they aren't setting up camp. They're just bedding down for the night. They might set up a camp for the night and moving on in the morning. I have been down to Cruces and saw the tent city. It works really well. The complaints you hear, like when we talked about the council meeting last time in Midtown, the complaints you hear are people are urinating, defecating all over the place, they're hanging out, trashing their place out, business outside. And the ironic thing is the tent city or pallet city or whatever you want to call it, that's a solution to that. People in Cruces, the business owners liked it, they didn't want it, but once it got there, the homeless kind of went away because they had a place to charge their phone. Another thing is I ran into a gentleman and his wife. He had worked for 8 days, and then it's not safe on the street. Nobody has a safe place to put their belongings. So as I've heard before, people say, well, I got to sleep with one eye open. There's this couple that were in their 30s. He said he worked for 8 days, and then he wound up having to quit. He couldn't take showers, his stomach really bad, so he couldn't bathe. And then the other thing was he couldn't sleep because he's on the street, he's dangerous, he's into red noise. And then the other thing, he was leaving his wife out on the street alone at night when he was working. And something like the Pallet City would, that would alleviate that for a lot of people and allow them to get it. And I've heard that more than once. How can you get a job when you can't pay?
Thank you.
And just one last real quick thing is, I know we've been talking about this forever. And I think it's time to get it done. Yeah. We need it, and we'll talk about it.
Okay, so we have a lot of more questions, comments, so I'm going to ask folks. Jesse and I will bounce back and forth, but if we can keep it to 1 minute, that would be helpful so we can get to everyone.
He's talking to me.
Okay. 30 seconds for you, Catherine.
No way.
You haven't, no, you're fine. I was talking to you.
I am a provider. I am a supervisor for case managers.
You gotta talk closer to the mic.
Right in your mouth. Okay.
You're on the voice.
I'm a case manager for providers here in Santa Fe. I'm also a neighbor and a 40-year resident of Santa Fe. So I have a foot in both worlds. As one of the things that breaks my heart are the number of mentally ill people who are not served by this community. The people who have behavioral health issues that make them unservable because of their mental health issues. They are not welcome in the shelters. Where can they go? There is nowhere for them. It's cold now here in Santa Fe, and they're on the streets. They are not safe on the streets. These are lovely little shelters. Do we have them in Santa Fe? No, we do not. The tents that we've seen on the screen, do we have them in Santa Fe? No, we do not. Where are these people going to be served? My case managers that I supervise every single day come and talk to me and say, so-and-so has no place to live. He got robbed last night. He got beaten up last night. She got raped last night. So-and-so got taken to the hospital last night. So-and-so was hit by a car last night and killed. What do? We don't have the resources here in Santa Fe. It's a disgrace. It's a disgrace. What do we do? What do you do in Colorado for these people? Because I know you have them too.
Yeah, every state does, right? Our country has failed people with mental health for decades now. Our biggest thing is getting in the mental health providers, making sure we're signed up with them. And again, they are strapped for resources and money. We do a lot of policy and advocacy around mental health and around mental health for health and in health alike. You guys, it is inaccessible. A lot of the lower barriers serve these individuals because they are lower barrier. We've also seen that with a lot of individuals who are triggered with noises, sound, people, right? We're able to see that decline when we can give them their own space. It doesn't mean we're not going to have episodic individuals with schizophrenia, right, who are untreated. But if we can gain that trust and start working towards that and work in our community, because the more you lobby your elected officials to get more mental health money, the better off everyone is going to be. Housing and house life.
We only need a few yeses. That's it. So we looked at 101 sites in Denver, 101. We were about ready to give up. We had a couple churches say yes, that was it, right? We had Cass say yes. So just keep asking, keep putting out the model, and wait, you just need a couple of yeses.
Makes it hard for me to trust and even stand here and speak in front of you. I met with Erica Kidd in 2013. She helped me become housed in a time that I was very afraid. I didn't trust. It was hard for me to keep appointments or remember a lot of things. Like one of the ladies said up there every third word. Like, oh, what happened just now? What am I supposed to do? I was afraid to fail. Erica helped me through a lot of that. Giving the service providers a chance is really important, and having these tools available for them to help us is very important. She was able to help me for a long enough period of time that I was able to go to school to vote. I became an esthetician. It was really great to finish with over 90% in my grades. It was wonderful. I feel very connected now when I look around the room. I see Marisol and Mr. John Bacon, who invited me to become part of their Lived Experience Advisory Board. That's a part of my community. Laura here, Erica. I'm sure there's lots more people here that I know. And so I just want to say, please take into consideration the needs and what we can do. I love people, I love pets, I love my community. When I walk down the street, I pick up pieces of trash. If I see someone in need, I help them. Helping somebody who needs help can really change their life. And it's beneficial to our whole community and for our whole planet in general. That's right. I just want to say
I have two basic questions. Is there any insulation in that little house? Is the insulation a double wall?
There's heat. I can yell. There's yes, very thin, but there is. You can crack one open one day. This one doesn't belong to me. If you go on their website, they show you how it's insulated. They also show you if there's heat, there's fire, and then there's AC.
Okay, the other question. The Western girl mentioned that the sponsor decides who is allowed to, what the threshold is. What percentage of the cost of the camp is shouldered by the sponsor and what is shouldered by the government?
I'm going to be really short. It all depends. I hate to tell you that. So if you were to step up tomorrow and say, I want to do this, we would work with whoever did that and figure out the model. It's going to be very unique to Santa Fe. So I will say it's really helpful to have foundation friends and churches. I mean, if we can get, government's great, but government usually comes in later where they should to help stabilize the programs over time. just because of the role they play in regulation. It's harder for them to lead these efforts, so.
Does the sponsors cover it 100% at first?
Well, you can say, I'm willing to provide this service, but I need to be paid for it, absolutely. So it's a negotiation based on the project.
Are you asking if it's gonna come out of your budget? Is that what you're asking?
Where the money comes from?
So foundations, right? So for CAS's, it was all privately funded. Okay, for other areas, it's been city. We've seen a lot of ARPA funds used for this. We've seen ESG funds, emergency services grant funds be used for this. We've seen different CBDG, community development block grant, lots of acronyms, we love our government acronyms. We've seen all of that be used for it. We see a mix right now in most of our sites. But we do not have providers who are supposed to continue to do their service provision, then taking on the full expense of this other site. One of the things that we ensure is that those who step up to do this, whether it be you're offering your land as a congregation or a private owner or whatever you might be, or you're the provider, that you're supported in that fiscally, because there's just no way.
We've been around for 24 years. We started in 1998, working with our homeless folks and their companion animals. We provide veterinary care, emergency, preventive. We're 24/7. We get calls 24/7. We provide leashes, harnesses. We work with other incredible organizations. A lot of you I know, Youth Works, LifeLink, the shelters. We are so fortunate in this community to have so many people that care, and it's proven out here this evening. It's my passion and part of my life, and I run this and work for another amazing organization, Youth Works, and we get a lot of kiddos running through that we also help in that capacity. But it is time, more than 18. And it is so vital, again, for these folks. We've been taking a lot of heat lately, if folks don't know that, in the paper and whatnot. There are some folks that don't think people on the street should have companion animals. And we've never had that in 24 years, and I figure I know where a lot of this comes from with our past president. But anyway, allowing people in lack of any civility. But we, all of us, we are out there. We go out every day. Joe, I work with Joe. He's amazing. Joe serves the human animal, and Street Homeless serves the non-human animal. Youth Work serves the human animals. And for these people out on the street, these family members, companions are all that they have. We know statistically it keeps one from using sobriety for a variety of reasons, mental health issues. So with the woman said, that we need to do this and we need to do this now, and Melinda said, we need to do this now. There is so much energy and love and compassion and care in this community and in this room. You said, ma'am, it's about community and different organizations. Mine can take care of the companion animals of our folks. Youth Works can do, Joe can do, Sainese, Pete's everywhere. We have that in this community to do this. And we need precisely Melinda to do it now. Please, let's do it.
Okay, let me check the
Hi
time.
everyone.
Oops.
I need to take some of the more important ones, and then later, if you like, we should have kicked this as a requirement to begin with. Could you speak to that?
Really, the only requirement we ended up with that was firm was that people needed to be 18 or over. And that really was really driven, quite frankly, by higher insurance. And it cost us a $5,000 rider to be able to take pets. So just so you know, there's expense involved here. But the way that we were funded, because we weren't funded with any kind of restrictions, we had that ability. We've always been, as an agency, low barrier. So we've never, if you were a sex offender, if you had a felony, any of those things would not keep you away from our program. We would learn about you together, and we would focus on what needed to happen after the fact that you're part of our community. So we didn't have that as an issue. And I think that that might be different for other groups, but that was the way we handled it.
Okay, so it is 7:30. If folks need to leave, please go ahead. We'll stay to field the rest of the questions, and you're all welcome to stay. Karuna.
Real quick, if you do need to leave and you have a question, you can put them up. If you have a comment, you can put them up. I also am happy. If there's someone who's like, wow, I still have doubts, wow, I have issues, wow, I still have concerns, I don't want to talk to them here, I'm happy to hop on the phone with you. I'm happy to hear you, I'm happy to learn what's happening in your neighborhood. I think it's important. So know that if there's somebody who doesn't want to raise their hands tonight, we're more than happy to hear you, we're more than happy to take that input and to have those conversations as well.
Hello, good evening. This is regarding the voucher system that is like blasphemy, pretty much to hear that New Mexico gave back anybody any money. That's ridiculous, you know? And considering how many new developments, apartment buildings that are going up across town, and that people cannot live up to their word when they say that, yes, we would like to build apartments and we will have affordable housing, yet when the apartment complex is built, they get rid of that and instead pay a measly fine. Now compare the money that we had to send back to the federal government to the amount of money that they're fined for a year. It doesn't add up. You know, you don't have to be a genius to know this is not, it's not nice. You know, you say something, what is a person if they worry and do nothing? All right, a couple million more in your pocket, oh well. But it's still not nice. That's all I have to say.
Thanks, Karuna. Okay, over here.
Thank you for the information. It was really good to see that in person too. So I have a question specifically for Santa Fe. So since you are coming with the experience of other cities and other programs, lessons learned, given Santa Fe's numbers, and I know that's underserved, but in an ideal world, when you get the funding and you have an ideal location, how many camps would you recommend? And what locations are the most successful? Are we talking about the industrial area? Are we talking about residential? And if it's residential, because I know you talked about being across the street from the Capitol, well, when we visited, that's, you know, that's not residential homes. Those are, you know, taller buildings, apartment buildings. That's a different type of residential. So if you are looking at residential, are you looking at single family? Are you looking more like urban environment? What works best for us to implement here?
So we've had them in everything, right? We've had them in multi-family homes, single family home areas, congregations across the Capitol, all those things, right? Same platform with issues. We were entering a pandemic. We were facing, and we continue to see more, is that congregate sheltering, is close to somebody else, is not, are in a state of trauma. Is that when you are in a state of trauma, I've said it over and over again, we face with the pandemic and the rising population. How do we keep people safe, and how do we do any trauma? And you have to fit here, or we cannot service. You can rest comfortably. SF actually has a global solution. We are working with engineers. We made individual safe spaces, non-congregate, managed community. We know that we have to have staffing. Now, staffing is universal. We have people who are housed and worried about these safe spaces. Staffing is 24 hours, they're on site. We have our unhoused neighbors who also want staffing 24 hours a day. It's for their safety, it's for their health, and it works. Hotels have staffing 24 hours a day, there's reasons. Bathrooms, hand washing. We want people to stop peeing in alleys, we give them bathrooms. laundry, meals, trash. We used security, we used locked fences. That wasn't because we were worried about the neighborhoods. It's because we had coded entry for those inside. And Cass will talk to a very specific population she served. It was very, very necessary, but we found it necessary for the safety of those who were also unhoused. We wanted to feel safe. You want to be able to lock your door, and we'll get to that too. And connections to services. This is where collaboration comes in. Each and every one of you service providers is doing an amazing job in this community, and you are stretched thin, and you are probably exhausted, and you probably need more money, and you probably need more staff, and you're watching your populations and the need for your services increase. Collaboration is key. We each have unique things that we can offer, and if we can collaborate and bring those together, we can truly serve individuals. The other positive thing about non-congregate shelter is that in areas where we see sweeping, abatement, whatever you want to call it, where we move people along, those outreach workers, those case managers who are walking, who are trying to connect, who are trying to bring people into services, cannot find those individuals. We can find them here. We can serve them here. We can gain trust, and we can start to build those steps to stability. These are different versions. So we use ice fishing tents in a lot of the first versions in Colorado. Only thing you could get. And they work well. Pallet is another option. These are not the only two options. But they're uniform sites. Okay, they're staffed, they're clean, they're uniform. They're community. I put this up here and I'm more excited that you get to go in and look at an actual pallet shelter, which we weren't sure was going to be here. Lots of important things, no matter what your structure is. The most important, most successful model right now is the pallet shelter, because you can lock the door. Now, service providers, if you question that, there's still access. We still have keys, we have emergency access in the back if there's a fire, right? They're heated, they're cooled, there's fire systems. But for those who have to live in them, you can lock your door. When you go home at night and you go to bed, how many of you lock your doors? How many of you lock your doors when you go to work? Being able to lock your door has been the most transformational thing for all of the unhoused communities that we have set these up in. They've actually slept. They begin to heal. You begin to not have to be awake all night, worried about your stuff. You're able to go and access services. You're able to go to work because you get to lock your door. One tiny lock makes all the difference in these communities. Now we're going to talk a little bit about Cass's model who actually ran one, and then we'll open up the questions.
I am way too old to be walking around, sorry. I have a safe outdoor space, and this is all I can do. So, thank you very much for having me. My name is actually Kathleen, it's like the two Kathleens, Kathleen Cronin. I go by Kaths. Those of you who are of a certain age will recognize Mama Cass Elliott, so just look at that. Wish I could sing like her, but I can't. Anyway, thank you very much for having me here. I did have the privilege of being the executive director of Earthlinks, who did operate the first, by a few days, of the safe outdoor spaces in Denver, Colorado, which we started in 2020. I'm going to tell you a little bit about Earthlinks and then just tell you about our journey of how we ended up doing that project, because these ladies have talked a lot about all the benefits of the safe outdoor space. I can give you some of our specifics. But let me tell you first a little bit about Earthlinks. So we've been around, we're a nonprofit in Denver, we're really little. Denver probably hardly knows of us, to be honest. Until we did the safe outdoor space, I think people were like, who is Earthlinks? Aren't they an ISP provider? Or maybe they're a marijuana farm. Or perhaps they are a golf club. None of that is true. But what we do at Earthlinks, and we're all pretty much privately funded, so we are not supported necessarily by HUD or government agencies. We have very little funding we've ever had from any of the governmental agencies, very small amounts, even through this entire process. We have been around for 26 years. We have started and worked with folks for that time by connecting folks that are on the margins with our planet. Feeling that the connection of sustainability and living in community and supporting one another is intimately connected, that is what we have done. And we've done very well with it. So we work small. We work with maybe 85 folks a year, all of which who come to us with the experience of homelessness. And then from there, at least 70% or more each year, we will have found one of the more permanent solutions that's been discussed here. A rule that people could only come and go maybe between 7 a.m. and 10 p.m. Well, that doesn't really work with people that are working in 9 jobs. That wouldn't work for them. It doesn't